Hello, everyone. My name is Anthony Edwards, and I'm presenting on the topic of helping children of deployed families or deployed military families. Um, I'm actually very happy to be presenting this topic. I could relate to the topic as a Army veteran myself. I do not have any children, but I have seen, you know, some of the issues related with parenting and having to get deployed and leaving your kids behind. And also, as a future counselor, I think this topic has a lot of weight, and it's something that is relevant for discussion. And I'm very happy to be presenting this topic today. All right, the next slide is showing one of the parents, like a single parent getting deployed. Deployment is defined as the movement of troops or equipment to a place or position for military action. Um, Deployment affects everybody. You know, it affects the military member, it affects their spouse, it affects other family members, and the biggest ones that are affected are the children, because they're young, and a lot of times they don't quite understand exactly what is going on. Why does mom and dad or dad have to leave home for so long? And they can associate that disconnect with, you know, mistrust, like mom or dad doesn't like me anymore, um, or my family is breaking up, and it creates a lot of anxiety for the children. It affects other family members the very same way too, but I think the children are the ones that are most affected because they're so vulnerable. Their minds are so young and still developing. Um, so this slide shows both parents, a family, extended family of both parents getting deployed. And one of the reasons I emphasize this is because it is tough, really, really tough for the parents and for the other family members, and especially for the children, to have both of your parents in the military and having both parents getting deployed around the same time. So as I have in the bullet points, I listed in some of the bullet points like the children, they suffer from that lack of emotional support, that lack of communication, because they will still be able to speak to their mom and dad. However, it's not as frequent as they would like, and they're not getting that face-to-face physical contact anymore. It's totally different, and that can cause withdrawal, um, and that can lead to depression. And we know that depression can lead can also lead to suicidal ideations or suicidal thoughts, and especially for those young children, um, they're very vulnerable to having those what we call cognitive uh, dissidence, or not being able to control their emotions or know what to do with all the emotions that are building up, and they might resort to harming themselves. Um, so this question is, how do children really feel about their parents getting deployed? A lot of times, as parents, we don't really ask our children that questions, or as providers, teachers, guardians, we don't really ask that question too much. So for the parent or guardians, usually by the time they find out their kids or their children are having an issue with them leaving or them getting deployed, it's already a little too late, because there is already a problem presenting itself, the child might start doing something that they never did before. Like we might see poor appetite start showing up, or the grades might start falling, or they start throwing tantrums, start acting out in school. So as a parent, by the time those things happen, or a guardian or a family member who is taking care of that kid, by the time they see those things and they come to the school counselor or the teacher to talk to the teacher, like, hey, something is going on with my child or the child that I'm looking over. Um, the problem has already taken root, and now it's the counselor's job, to assess the child and to try to, help that child in the best way possible. So this slide, I just put in a little bit of research material here. What does research say? And the first one says that, prior research indicates that children of deployed parents are at risk for emotional problems. Um, and like, as I mentioned earlier, once a parent or both parents are getting deployed, it creates, a vacuum of that absence that um, a lot of children start feeling neglected or they start acting out. So they're going through a withdrawal time. They're still young. Mom and dad have always been there in their lives, and then all of a sudden, mom and dad has to go. They feel like mom and dad has neglected them, and it does cause a lot of emotional problems. The next one is parental emotional socialization has been theorized to influence children's behaviors. So this just highlights the first point, that the absence of the parents in the children's lives will cause, you know, um, emotional problems, or that withdrawal that causes children to act out. Excuse me. And it's a tough time, and a lot of times the children can't even we can't hold the children accountable for their actions, um, because their minds are still developing. A lot of times they don't know how to handle those emotions that are being presented, and so they act out to gain attention, or to just for comfort. Mom and dad is gone, so I will fill the void with something else. The last one is findings suggest a targeted approach to prevent it to excuse me. Findings suggest a targeted approach to preventative interventions for military spouses who are parents of young children. Um, the targeted approach to preventative intervention. Um, that's where we come in as counselors. Once we're presented with a case, we have to assess the child, assess the situation, and do our research, involve data into the assessment process, and collect as much information as we possibly can, so, so that we can intervene, and we can intervene on the right levels and see exactly what that child needs, what that child need in his or her life, um, and be able to provide that service for that child. Um, so getting the child or children prepared for deployment. Yes, the child is not getting deployed, it's the parents getting deployed. However, the child is a important figure in the family, and also they're young, and the parents are leaving for extended periods. Usually in the military, when you get deployed, you're gone for a minimum of like 9 months at a time. So you have to, as parents. So the parents have to play a role in this. The parents have to make sure that their children, they sit their children down and talk to their children about getting deployed and what that's going to mean for him or her as a child. Um, how long they're going to be gone. Be open and be honest with the child. Do not play games with the child and let them think that you're only going to be gone for 2 days, or I'll be back tomorrow or whatever. Let them know, mommy and dad is going to be gone for a while, but we'll be back and we love you and we'll be in contact and stuff like that. The guardian, in the absence of the parents, have to do the same. And the teachers, because a lot of times parents speak to teachers first, or it might be vice versa. The teacher might speak to the guardian about the child's behavior or about the child's performance in school. So usually these two people might might be informed first, the teacher or the guardian, of the child's outburst, the child's behavior, um, before it gets to the counselor. Um, so that is why, the role of the teacher is very important in passing along those information to the school counselor. And as a counselor, our role, as I stated earlier, we assess the child based on the presented uh, case or situation. We assess the child, um, and then we provide needs assessment based on the assessment that we made for that child. We will proceed to taking interventions to advocate to make sure that those needs, the child's needs, are met. So what we say as parents and what we say as counselors, as parents, um, it's all up to the parents' experiences, um, or level of guidance. Um, so if the parent is very, or parents are very experienced, they are able to um, transition that child into that phase of getting deployed by taking all of the necessary steps. Like, excuse me. Yeah, so for taking all of the necessary steps leading up to their deployment, ensuring that that child or children are well versed with everything that needs to be done before the parents, are gone from their lives. Um, and as the counselor, we know our role. So once we're presented with a case, we we're able to counsel that, provide counseling services to that child or children. We're able to give referrals in areas that we're not proficient or certified to handle. We're able to give that child the proper referrals so that child will continue getting the help that he or she needs, and also so to provide resources in cases where that child might need financial assistance, or they might need some kind of other accommodations. We're able to also provide those resources. The services that we provide as school counselors are very, very essential. Um, Taking into consideration that we are school counselors, we are dealing with a population of children that are within, school age, and they're dependent on us, the providers, the the staff, the faculty of that institution, to help them to gain that success in school and also in the community as a whole. And as school counselors, we are aware of all those factors And that's why our service is so essential, because we're the bridge between the children and the level of success that they could have potentially in their lives. Um, so in the absence of their parents, um, they come to us with their case. We're able to give them that essential counseling service and all of the referrals and assistance that they need. In conclusion, the children are the future of our great nation. Therefore, taking care of their socio-economical, cognitive, and physical needs should be our priority as parents, guardians, and school counselors. We are better able to prepare the children to face life's challenges and perform better in school and in society as a whole with strategic, systemic interventions. And just to add a little icing to the cake, our role as counselors it's so it's essential. Um, we have so many different counseling techniques that we can use to help those children. We have resources that we can use to help them. We can collaborate with faculty members, staff members, parents, the community to help those children, and we're able to go as far as the Board of Education if necessary to try to help those children get all of the resources, all of the help that they need. And that is where our interventions come in. That is where our collaborative skill and techniques come in. And the children, they are dependent on that. And that's that sets us apart from all of the other providers within the school system. As a school counselor, we're able to give them that much in the absence of the parents or guardians in their lives. And that ends my presentation, ladies and gentlemen. Thank you very much for listening.